Nurses on the front lines of the COVID pandemic and every other nurse who chose the profession says that being a nurse really is a calling. And tonight, our senior health correspondent Monica Robbins brings us the story of one nurse who was thinking about leaving her career until she met a patient who gave her some incredible, touching perspective.
Maria, you are a remarkable woman. We battled through some tough times in a very short time.
It's been 4 months. Michelle Brownlee rarely visits patients at home. This case is different.
Hello. Hello. You're so very special to me. Our connection was different from regular ones.
Michelle, come on in.
Maria.
Oh, it's so good to see you. I missed you. I really missed you, Michelle.
Michelle and Maria Pescrilli met in December, brought together by terrible circumstances. Maria, her son, and her mother, Carmen, all got COVID and all went to the hospital. Mother and daughter ended up on Michelle's floor at University Hospital's Parma Medical Center.
So Maria was in this room right here. This is room 925.
At the height of winter's Omicron surge, Michelle, a frontline COVID nurse, saw her caseload of very sick COVID patients double. But Maria stood out.
You know, the whole time you battled COVID, you were selfless. All you worried about was everybody but you.
Well, I don't need to worry about me because I know I've been well taken care of.
All the care in the world could not help Maria's mother. For the first time, the patient, who could only think of others, had just one request: to see her mother one last time before she died. A small request that would take a Herculean effort.
The hallway looks clear now, but during the midst of this COVID crisis that we were in, it wasn't clear like that. And then we brought her into this room, 908, and we faced their beds together. So Maria was facing the wall, and her mom was facing out here. And I told her, you know, Mom's probably not going to respond, but I promise you she can hear you.
Maria spoke to her mother in Italian and held her hand. A nurse captured the moment for the family. Within a few hours, Carmen passed.
And I thank you so much for all the things that you have done for me. Because without you guys, I probably will never be able to say goodbye to Mom.
You know, I sat by her bedside and I cried, she cried, and she says, it's okay, it was her time. And, you know, she just says, can you help me make her arrangements? And hence that list that I have, that I wrote down everything she wanted me to do.
Michelle's cried a lot these past 2 years, but kept the list and her promise. The stress, hours, demands, and all the deaths have broken even the toughest caregivers. Michelle weighed whether to quit until Maria tipped the scale.
If this is what nursing is going to be for the rest of my life, I can't do it. It's devastating. Just to sit next to her, you know, to feel the positive energy that she had and to be so positive, and it's immeasurable. You know, the bond that we have is immeasurable.
Nurse and patient helped heal each other. Michelle needed Maria to know what she meant to her.
But you have left an unerasable mark in my life. I promise you did more for me during that time that I could have ever done for you. Love you always, Michelle.
Thank you. I appreciate that.
That was Monica Robbins reporting. Michelle decided to remain a nurse, and she says she and many others are helping relieve their stress by utilizing mental health services provided by UH.